Advocates are calling for more meaningful reform at a New South Wales Drugs Summit, which began in the town of Griffith for the first of 4 forums. The regional forum proved a chance for the state government to hear from regional community members and service providers about the unique challenges that they face. Robert Stirling is the CEO of the Network of Alcohol and Other Drugs Agencies. He spent the day at the forum and he joins us now from Griffith. Robert Stirling, welcome. So what do you think of the fact that this summit is actually being held?
Look, we think it's a positive thing that it's being held. We're interested in reform. We're wanting to ensure that if people are wanting to access treatment and support in New South Wales, that they can. And I think for today, it was important to hear from local people in regional New South Wales. And we certainly heard from lots of local providers, including police, about their experiences. It was unsurprising that there's a lack of services in regional New South Wales, and people are having to travel long distances to access treatment and support. And I think it started well with the local Aboriginal Lands Council welcoming us and providing the Minister with a gift, the Minister for Health with a gift and a request for deep listening. And I think it was positive. I mean, at this stage, we feel like nothing's off the table. There was discussions about decriminalisation, about drug checking, and about diverting people from the criminal justice system as well.
Yeah, and so the first thing you mentioned there was treatment support in the regions. What are some examples that you're coming across of the lack of support for that in regional New South Wales?
Well, I think it's, New South Wales is a large region, and I think for some people those distances are vast. And a lot of people talked about that presenting a barrier, and for some people not accessing treatment because of that barrier. And of course, then there was culturally appropriate services and the limited access to those services as well.
And so, some people might have an impression of regional New South Wales as being kind of away from the drug problem, but to what extent has, for example, ICE got into the regions?
That's definitely not the case. I think drug use doesn't discriminate. It's not just a city issue. It happens across the regions. And I think what we found, and I think what's important to hear from the regional forums, is that there are differences within different communities. For some communities, alcohol may be the primary drug of concern, but for others, it might be methamphetamine or cannabis. And I think that's what's really important for us to understand, that there is no one size fits all, and we do need to listen to communities and different communities.
And so it seems your focus is on treatment rather than prevention, but what would you like to see happen in the prevention space in the first place?
Well, I think prevention and early intervention is one of those areas that is poorly funded, and with that as well, harm reduction services, because we're wanting to reduce harm for people that do use drugs. So what we're really wanting to look at is to ensure that services across the continuum of care are available for people, from prevention through to those more acute services where people might need more intensive treatment options.
And does prevention include decreasing the number of people who are going down the path towards drugs in the first place?
Absolutely, that was definitely discussed. We talked about school education today as well. So I think what was positive is that there was a diverse range of views today. It wasn't just hearing from health providers, which are obviously very important, but there were representatives from education, police, and of course we had a number of ministers representing a number of different portfolio areas as well.
And so what are you hoping for at the end of this process? Because I think there are 3 other meetings, one happening in Lismore and Sydney as well.
That's right. So I think for me, at the end of the first day, it's hard to know how they're going to bring together all this information. We know that the 2 co-chairs, Carmel Tebbit and John Brogden, will be tasked with pulling together a report. And I think what the sector doesn't want is to have to wait at the end of the Sydney dates to understand what the government is going to do. We do want meaningful change. We do want to make sure that services are resourced and that people who are wanting to access treatment and support can receive it when they need it.
Yeah, and you mentioned that there was a bit of discussion about decriminalisation. What would you like to see happen on that front?
Look, I think for us, our services see firsthand the impact that criminal penalties can have on people. And for some people, that may impact on their housing, employment or education. So we're definitely wanting to see people diverted away from the criminal justice system for low-level possession of drugs.
And to what extent are we seeing that happen already?
Look, there was discussion about the early drug diversion initiative that the government has started, but it's still very early days.
Right.
And I think we still need to look at ways that we can improve that, noting that, it's only just begun and there's differences in the way that it's being implemented across police across New South Wales.
Okay, Robert Stirling, thanks so much for having a chat to us from Griffith in Western New South Wales.
Pleasure. Thank you.